So, hello and welcome. Our topic for today: infectional diseases and some immune deficient conditions. The first disease, which we will discuss today, is plague. Plague is the most acute, especially dangerous quarantine disease, which caused by the plague bacillus, Yersinia pestis. So you may see Yersinia in this part of the slide, and it's really important um, to know that it's really life dangerous disease, and you should do um, any steps for quarantine and to isolate some uh, patients with plague. You should be able to diagnostic the plague according to morphological manifestation, and it will lead to uh, best results of epidemiological situation. Because in case of plague, we may talk about death of patient in mostly cases. Something about 99% of cases with plague will lead to death of patient. And you should be really um, safety about your life, and you should save life not only yours but all personnel who will be around you. The special features of this pathogen associated with some special enzymes which this bacillus has. It has fibrinolysin and hyaluronidase, and these enzymes lead to special anatomical manifestation of it. And It leads to lysis of tissues, it leads to necrosis of cells, and also it leads to some special type of inflammation. The typical inflammation for plague is serous hemorrhagic. And the second feature is some changes in cells like macrophages. We may see some changes in these cells. I will show you later. And epidemiological features of plague associated with natural focus of it, and we may see it in Georgia, sequirals, and Gorfes. And also it's really important to understand that the ways of spreading of this infection associated with animals like cats and camels. But these animals may be only the source of infection, and the most important organism in transmission way is flea. And flea, when it bites human, it transmits the Yersinia pestis from the animals like cats and camels to patient. And we may see some infectional routes or ways of spreading of this infection. And the most important factor is flea, which beats human, and we may see formation of primary tuberculosis or primary plague complex. And primary plague complex consists of primary affect, and primary affect associated with place of bites. The second way of transmission is contact way, and it's associated with contact of human and animal. Also it's possible, but it's really rare situation. And one not rare but the most dangerous way of transmission is airborne. And airborne type of transmission leads to really difficult epidemic situation because it leads to the fastest way of transmission of plague, and it lead to the fast death in patient, because airborne way of transmission associated with development of pneumonia, and the really difficult pneumonia, which lead to some insufficiency of breathing, and lead to the really fast death of the patient. Pathway of distribution in the human body, so the ways of dissemination of plague in human body associated with two ways. They are lymphogenic and hematogenic one. The lymphogenic way of spreading associated with spreading of infection by lymphatic vessels, and the first of all and the second part of the primary plaque complex, we may see lymphangitis, and we may see lymphadenitis. And in the result of lymphadenitis, we may see formation of bew bones, and I will show you some special bew bones on the next slides. And hematogenic spreading of the infection, which is associated with formation of secondary bew bones, secondary plaque pneumonia, dystrophy, and necrosis in all internal organs, hemorrhages, and sometimes it may lead to formation of special plaque sepsis. When we talk about the plaque, we should remember about special clinical and morphological forms of it. There are four main forms of it. We are bubonic one, which associated with formation of bew bones, skin bubonic form. In case of skin bubonic form, we may see not only bew bones formation, but also we may see changes in the area of bite in the skin, and some anatomical manifestation I will show you later. And we can see primary pulmonary type of plaque, which is associated with aerogenic way of spreading of the infection, and it really dangerous in epidemiological point of view, because it lead to really difficult pneumonia and lead to really fast spreading in population of plague, and in 100% of cases it will lead to death of patient in first day or some hours probably of plague. The nature of inflammation in plaque is serous hemorrhagic, but sometimes we may see formation of purulent inflammation and accumulation of a sap in the place of primary plaque complex. So we should talk about each of forms a bit more. The first form is bubonic form, and in case of bubonic form, we couldn't see primary effect. So the place with bite, we couldn't find it, but we may see changes of lymphatic lymphatic nodes, and we may see formation of bew bones. Lymphogenic progression of the plaque in this form associated with formation of bew bones of secondary and tertiary level, and it will be associated with spreading of infection according to lymphatic vessels. In organopathology of this form, we may see the lymph nodes are enlarged, and this increase of the size associated with edema, of the formation of inflammation in the lymphatic nodes, and it will lead to solderate of them, of the dirty consistent. On the incision, they have dark red focus with necrosis, and this dark red color associated with special hemorrhagic type of inflammation in this type of infection. And also we can see periadenitis. Periadenitis is inflammation in surrounding tissues, tissues which surround the lymphatic nodes. Microscopically, we can see steps of its development. First of all, we may see formation of serous hemorrhagic inflammation, and the cause of serous hemorrhagic inflammation here associated with development of or not development, but with result of activity of some enzymes of plaque bacillus, and which lead to necrosis and formation of purulent inflammation. And after purulent inflammation, we may see formation of ulcers here. And after it, in really rare cases, we may see formation of scars in place of bew bones. But mostly patient will die, and we couldn't see any scars after the bubonic form of plaque. On this slide, we may see bew bones, very localized in the axillary area mostly, or in area of other big lymphatic nodes. They looks like heels under the skin, and these heels has really painful in touch, and they have really red color. They also becomes hot, and sometimes they has red color. Skin bubonic form of plague, we can see same anatomical manifestation like in bubonic form, but also we may see primary effect here. And primary effect is a bubble with serous hemorrhagic content. And the bubble localized in the place of bite of flea bites. And it's only one difference between bubonic and skin bubonic form. And but it's really important because the most important difference between them is formation of primary effect with bubbles. Primary pulmonary form associated with airborne way of spreading of the infection, and we may see all these changes in the lungs. We can see formation of serous hemorrhagic pneumonia. We can see serous hemorrhagic pleuritis, necrosis, and suppuration. Also, it leads to really dramatically edema formation in the lung, and we can see decrease of respiratory function of the lungs. And that's why it's really dangerous and lead to death of patient in probably 6 hours after absemination. Really dangerous type of plague. On this slide, we may see some changes in the lung. So we can see areas with hemorrhagic inflammation here with dark red colors areas, and also we may see some necrotical area here, and we can see great edema here, and really dramatically change in anatomy and histology of these organs. The next form is primary septic. Primary septic form of plague associated with hematogenous dissemination of a process. And in case of primary septic form, we can see any typical manifestation for sepsis. And as you know, the sepsis is a cyclic and disease with any typical manifestations. So the anatomical manifestation of sepsis in plague will be same for sepsis in staphylococcus, for example, or any other sepsis with any other causes. And that's why we really difficult to diagnostate the plague here, and we really need to do diagnosis, really difficult diagnosis. And diagnostic conditions caused based on bacterioscopic examination, bacteriological examination, and biological experience. So these steps are necessary for fast diagnosis of plague. And if you see patient with sepsis, it's really necessary to do bacterioscopic and bacteriological examination. In especially if you couldn't see the infections gate, because in case of plague sepsis we couldn't see gates of infection, and that's why it's really difficult to diagnostic it, and it may lead to really dangerous problems in epidemic situation. One more photo with hemorrhagic pneumonia, histological changes. So we can see accumulation of erythrocytes in the alveoli, we can see a red area in the lungs, and macroscopically lungs become red color. And one more photo or picture with bone of the leg. So we can see lymphatic node which is increased in size, has red color, and it's really painful. Patient, any touch in this place will lead to great pain, and it's typical manifestation of it. Complications of plague associated with development of secondary focal plague pneumonia. And if we talk about any type of plague except primary pulmonary type, we can see development of secondary pneumonia. And secondary pneumonia will be associated with same changes like in pneumonia type of plague. We can see serous hemorrhagic type of inflammation here. We can see really big areas with red color in lung, and in these areas we may see some manifestation of necrosis, edema, and blood accumulations. And the second complication is cachexia, and I hope you remember it from our previous classes. Cachexia is a result of really difficult and long time in duration diseases, but in plague, cachexia develops in hours, and it's show how plague is dangerous for life of patient. And formation of sepsis, it's really typical complications of any forms of plague, but not only primary septic one. The next disease is tularemia. Tularemia is infectional disease from the group of anthrapozoonoses. It means that the source of infection is animals, according to acquaintly and chronically caused by the tularemia bacterium. Tularemia bacterium is a Francisella, and it also may lead to really dramatically reactions, hyperimmune reactions in the place of its primary effects. Routes of infections may be contact in case of contact of a human with bacillus through blood-skin animals like ticks or mosquitoes, water-based and food-grade. And the different way of spreading will lead to different clinical and anatomical manifestations, and we may see different localization, different anatomical picture in association of routes of infection. Pathway of distribution in the human body or ways of dissemination may be again lymphogenic and hematogenic one. Lymphogenic way associated with primary affect, lymphangitis, regional lymphadenitis, and primary tularemia bubons, which may localize in axillary cavity and inguinal cavity areas. Hematogenic way of dissemination associated with formation of sepsis or bacteremia in blood, and we may see focus of tularemia in any internal organs again. Clinical and morphological forms, we can see bubonic form, which is associated with injury of lymphatic nodes and formation of bubones as in plague. Pulmonary form in airborne type of spreading of this infection, and typhoid form in case of formation of sepsis, and more typical for elementary way of spreading of this infection. The nature of inflammation, mostly serous hemorrhagic, and may resemble the plague one, serous fibrinose, and the most typical for tularemia is productive inflammation with the formation of tularemia granuloma. And granuloma in tularemia will look same as tuberculoma in tuberculosis. So we may see bubonic form in the formation of primary tularemia complex, and primary tularemia complex consists of primary affect, lymphangitis, and lymphadenitis. Features of granuloma in tularemia will be same like tuberculosis one. In the center, we may see caseous necrosis on periphery epithelioid cells and gigant cells of Pergolan Hans. But the special characteristic of tularemia granuloma will be formation of separative inflammation in this area, and we can see accumulation of neutrophils. Pulmonary tularemia associated with cirrhosis fibrinosus or cirrhosis hemorrhagic inflammation, development of necrosis, and formation of granulomas in the lungs. Typhoid or septic form of tularemia associated with septicemia and multiply hemorrhages. We can see hematogenous dissemination of the process. We may see changes in blood flow and formation of hemorrhages, and it's typical for septic form of tularemia. It's really a dangerous life condition because it leads to development of necrotic and dystrophic areas in all internal organs. We can see insufficiency of all internal organs and it leads to death of patient. Outcomes of tularemia associated with formation of non-healing ulcers, formation of fistulas, and organization with scarring. So a few words about fistulas because it's really typical for formation of granuloma with separative inflammation, and we may see a lot of SAP in case of tularemia, and it's typical, it's associated with some characteristics of tularemia bacillus. Complications of tularemia associated with sepsis and development of pneumonias. The next disease is anthrax. Anthrax is acute infectional disease from the group of anthrapozoonoses, and the etiological factor of it is anthrax bacillus, and the typical way of contamination through the skin or alimentary or aerogenic route. But the typical anatomical manifestation of plaque is formation of a plaque of anthrax is anthrax carbuncle. Anthrax carbuncle is a special bubble with dark or black surface and with cirrhosis hemorrhagic cirrhosis hemorrhagic fluids in it. So it may looks like that or that, so it may have different images, and also we may see different forms of anthrax. We can see cutaneous form of anthrax, and the typical anatomical manifestation of it will be anthrax carbuncle, and I have already showed you on the previous slide all of these manifestation is anthrax carbuncle. Intestinal form of anthrax is hemorrhagic inflammation in the ileum. Primary pulmonary cirrhosis hemorrhagic pneumonia may be developed as a result of anthrax, and primary septic we may see as a result of it development of hemorrhagic meningoencephalitis, and the typical manifestation of meningoencephalitis in anthrax will be formation of great hemorrhage in surface of brain. Brain becomes red color, and it's really typical manifestation of anthrax on the autopsy examination. The next disease is human immunovirus infection, and on this slide you may see a number of cases which with human virus in our planet by continent, and you may see that it's really popular disease in our planet, and it's really epidemic situation nowadays. Any continent has patient with it, and we should treat it, and we should know how we should treat it. Symptoms of human enterovirus in infected patients you may see on this slide. But it's really important to understand that the special aim of HIV is CD4 cells. It's CD4 lymphocyte. And CD4 lymphocyte have typical and the most important immunological functions. We protect our body from any infectional disease, from our opportunistic microorganism, a special microorganism who lives in our organism and do some special functions. And we may see some periods mm, of this infection. The first period is period of incubation, and incubation period of HIV takes sometimes from 6 months to 6 years, and it's a really different type of different type of rising of infection in different patients, and it consists of uh, time of recirculation of immunovirus, its replication in the CD4 lymphocyte cells, and in the period of manifestation, it may like associated with depress of immune system. We may see more often infectional disease in this patient. Sometimes the diseases will have not typical clinical picture, and so on and so on. And in the duration, we may see pre-AIDS situation. Then we can see a lot of infections with long course and a non-typical clinical picture, and AIDS period when patient has opportunistic infections, has disseminated candidiasis, and has some atypical tumors, for example, Hodgkin's lymphoma or um, brain tumors as well. So, in the result of HIV, we may see formation of AIDS syndrome. And also, AIDS syndrome is a mirror of depressed immune system, and we can see two groups of diseases which are indicate uh, AIDS syndrome. We are candidosis of disseminated localization. It may be candidosis of esophagus, bronchus, or lungs. Extrapulmonary cryptococcosis, cryptosporidosis with diarrhea lasting more than 1 month, cytomegalovirus lesion of any organs with the exception of the liver, spleen, and lymphatic node in the patient older than 1 month, infection caused by the herpes simplex virus, ulcerative lesion on the skin and mucous membranes that persist longer than 1 month, herpetic bronchitis, pneumonia, or esophagitis of any duration in patient older than 1 month, Kaposi sarcoma in patients younger than 60 years old, brain lymphoma in patients younger than 60 years old, lymphatic intestinal pneumonia or pulmonary lymphoid hyperplasia in children under 15 years old, disseminated infections caused by mycobacteriums with damage of various organs except or in addition to the lung, skin, cervix, or basal lymph nodes. Pneumocystic pneumonia, progressive multifocal leukoencephalopathy, toxoplasmosis of the central nervous system. Uh, AIDS indicator from the second group contain bacterial infections combined or recurrent in children under 40 years old, septicemia, pneumonia, meningitis, bone joints damage. So we can see development of problems with central neural system and development of dementia, disseminated histoplasmosis with extrapulmonary localization, esophagitis with diarrhea persistent for more than 1 month, sarcoma of Kaposi in people over 60 years old, brain lymphoma in people over 60 years old, over B cell lymphomas or lymphomas with unknown immunophenotype, mycobacterial disseminated injury with lesion in addition to the lungs, skin, cervical or basal lymph nodes, extrapulmonary tuberculosis with damage of organ other than lungs, Salmonella septicemia replacing, but Salmonella not Salmonella typhi, and so on. And all of these eight indicators lead to or based on three of the most important syndromes. Syndromes of HIV infections or AIDS infection or AIDS syndrome. We may see pulmonary syndrome, neurological syndrome, and intestinal syndrome. Pulmonary syndrome of AIDS associated with uh, atypical diseases of lungs. For example, it may be pneumocystic pneumonia, which characterized by phloem eosinophilic exudate in the lumen of the alveoli consist of the edematous fluid protein pneumocysts and dead inflammatory cells. So we can see all of these manifestations here, and also we may see pneumocysts in these areas and also in this area. So we may use hematoxylin as the reaction or special methods of staining here. The next step of pulmonary syndrome is cytomegalovirus infection, and for cytomegalovirus infection are typical huge cells with huge nuclei, with big nuclei, and with light corona with light corona in the center. And also we can see basophilic granulation in these cells. So these cells are typical for cytomegalovirus infection, according to morphology. The next syndrome is neurological one, and acute meningoencephalitis. Acute meningoencephalitis associated with changes of furrows. They are poorly expressed. Some areas could lead to the fact that they are impaired with exudate, so you may see it here, and it is one of the stage of dementia in case of this disease. And also in histological level, we may see perivasculitis and accumulation of inflammatory cells around the vessels in the brain. We can see inflammation in the brain, and it's also will lead to edema of brain, will to degeneration process in the brain tissues, and also may lead to dementia. The next manifestation of neurological syndrome is progressive multifocal encephalitis, and it's characterized by multiply heterogeneous focus of the granular type in white matter of the brain, and you may see this damaged area here, and it's really difficult complication because sometimes we may see paresis, paresthesias, we can see decrease of mentioned of patient, depress of education level, and so on. Interstitial syndrome is the last one, and it's associated with some manifestation in gastrointestinal tract. So first of all, we can see candidosis of esophagus. Esophagus or oral cavity or other localization. Candidosis is typical manifestation of AHC syndrome. It's characterized by brownish yellow plaques in the mucous membranes of the esophagus. And cytomegalovirus infection of the intestine. We may see some changes here, so it's unusual for healthy patient, for patient with who don't have who doesn't have HIV infection. The next manifestation of interstitial syndrome is Kaposi sarcoma of stomach, and we may see formation of this tumor on the mucous membranes of the stomach. Macroscopically view you may see here, and histologically we can see atypical cells in the glands of stomach. So, and in the conclusion, the morphology and morphological picture of HIV infection is really different, and it depends on type of cells which are involved in the process. So the first of all and most damage is localized in the T4 helpers lymphocytes. Also, we can see damage of monocytes and B lymphocytes, and these changes lead to depress of immune reactivity of organism, and may lead to opportunistic infections and tumors. Opportunistic infections like candidosis, like pneumocystic pneumonia, and so on, and tumors like B lymphomas of brain, and formation of sarcoma Kaposi. As a result, the different diagnostic of disease required the use in each specific case of a complexity study of the material with extensive use to additional methods of staining or some immunological methods of examination to identify of pathogen. Nowadays we can see a lot of methods of diagnosis of HIV infection, and we should find this patient and we should help them, and we may help them. It's not so difficult as it was some times ago, probably 10 years ago. And nowadays HIV infection has a good results of treatment. We can prolongate the life of this patient for a long time, for 10 or 15 years. And some immunodeficit syndromes in the end of our lecture. The first one is Bruton's disease, associated with failure of B cells. Light change of immunoglobulins are not produced, and we may see a lot of heavy change in the cytoplasma. It leads to problems of immunoglobulin reactions in our organism and depress of immune activity. Also, it has X-linked in males. Mostly we may see this disease, and it's a genetic disease associated with X chromosome. Present about 6 months after birth, and the typical manifestation of this disease in young age, in 6 years or in 6 months of life. And in this age it may be associated with a lot of childhood infections. We may see development of Streptococcus pneumonias. Also we may see some streptococcal infections, so Staphylococcus infections, and so on and so on and so on. And also we may see rising of viral infections here. Poliomyelitis, coxsackie, ehoviritis, and so on and so on. And the typical changes in the peripheral blood is absence of plasma cells. The next syndrome is DiGeorgi syndrome. It's failure of third or fourth parenchymal pronodes to develop. Parathyroids. Also we may see some changes in thymus, cleared cells of thyroid, ultimobranchial body, and so on. Also, it is associated with congenitally small or absent thymus, and thymus is a center of immune system of our body, and we can see non-specialized T lymphocytes, and also we may see reduce of them or full absent of them, and we can see paracortex of lymph nodes depleted, para-arterial sheets of spleen depleted also, and we may see some changes of cell reactivity. So with DiGeorge syndrome associated with problems of cell immune reactions. And as a result, it leads to accumulation of viral and functional or protozoal infections. We can see a lot of different infectional diseases here. May have multiple congenital defects and associated with some congenital defects in organism. Sometimes it may be defects of heart, defects of internal organs, or chromosome defects, and so on. So probably it's all for today. Thank you for your attention and goodbye.